4:30 in the morning.
And you've woken up for our class.
Yes, yes.
Happy New Year. Yes, Hima madam. Okay, so I hope you gain a lot from depriving yourself of that sleep.
या जो जागा है उसने सो पाया, हमारे कहते हैं ना, जो जागत है सो पावत है, जो सोवत है वो खोवत है.
Okay.
It's an old saying.
Yes.
हमारी दादी माँ गाया करती थी.
Yes. Come, we'll start with the class. We are quite a few of us.
Because the network is not right. I was trying for the past 5 minutes. Now I got it.
Okay. Happens. But at least it is giving us a platform wherein we can meet each other. We can share so many skills. We did not know all this existed before COVID. Okay. Come, I'll just share my screen. So all the newcomers, welcome. In case you don't follow, why is this happening? 1 second. Okay, you all can see my screen, right? Are you able to see my screen?
Yes, ma'am.
Understanding ankle, knee and hip pain, right? So this, to the newcomers, let me just repeat it, is my favorite slide. Knowledge is power, information is ammunition, and awareness is enlightenment. The ancient maxim, know thyself, applies to every facet of human existence, especially to one's health. The prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize it, and then how to go about getting the right kind of treatment. Now, what is the meaning of all this? Knowledge is power, information is ammunition, and awareness is enlightenment. The more and more we know something about maybe our body, here we are referring as a medical camp to our body. The more and more we know about it, the more and more we know how to go about with it. What is the meaning of how to go about? What plan of action to take? Where to go? How to go about things? So, what my aim as an educator here is, I will not be offering any kind of treatment or any kind of tips or suggestions. Okay, you go ahead, do this, do that. No, it is just a platform where we speak in general. I explain the anatomy to you, and then I explain what can be happening and what you shouldn't be doing, what are the restrictions and the contraindications, and how you can go about with your ailment. So that way we take different medical camps every Tuesday and Wednesday, 3 to 4 p.m. We take different camps on various topics. So now we have many people who are there in Get Set Up since the past 3 years. Now in December, I think we will finish 4 years. So you have learned a lot about your body, your ailments, but we should resist the temptation of self-diagnosis, self-medicating, even self-investigating. You should be consulting a good doctor. Do not take this whole scenario of managing your disease on your own, thinking that I have Mr. Google at the click of a button, thinking that I have attended a lot of camps, let me manage it on myself. No, that's wrong. Okay, but if we pick it in the first stage, see, this prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition. What does this mean? I pick up my disease in that stage 1. I nip it in the bud. I do not allow it to become like a big snowball effect when it has become the last stage and it has become irreversible and incurable. So these camps are just for you to pick up your diseases in the early stages and then go about getting the right kind of treatment. Right? That's my explanation for this slide. Now, what are the objectives of today's class? We will learn that strengthening of the muscles, ankles, knees, around the ankles, knees, and hip region help the muscles to have a firm grip around the bone, thereby preventing risk of injury and fractures. So what is the meaning of this slide? Come on, let me see if you all can discuss with me. What is the meaning of this? Why do the muscles need to have a firm grip around the bone? Hello, Parin, Sankara, Sundari, V. Shobha, welcome newcomers. Come on, senior students, tell them what we mean by this.
Protection.
How protection?
If there is no support, the muscles will hang here and there. There should be some support for them. Na? Support system they provide only by bones and tendons.
Okay. Okay. No, what does this line mean? That we have to learn that the muscles need to be gripping the bone. What does this line mean? Why do the muscles need to be gripping the bone well?
So when you fall or balance is lost, they give you the support.
Yes. Okay. So suppose in the night I forget to switch on the light and I fall down. But if the muscles in the washroom, I go, I fall down. If my muscles are gripping my hip bone very well, gripping tight, then even if I fall down, I will not get a fracture. Okay. So the newcomers, I'm repeating this very important line to you. Do you think you can increase bone density with the help of popping calcium tablets? At your age, do you think you can increase the calcium intake and the bone density? No. Can you explain? Tasneem madam messages, she doesn't talk. And why can't you do that? There are newcomers, we need to educate them. So what happens is those calcium tablets, whichever calcium you are taking, calcium carbonate, whatever, all the external medicines are acidic. Okay. Now we have learned that for an acid, we need an alkaline base, right, to antidote it. So the existing calcium which is there in your bones, which is given by God, that is alkaline. And what this calcium does, the external calcium which you take, it leaches out that good calcium which is very little remaining because you all are senior citizens. It leaches that out to neutralize that. So there is no way of increasing bone density in our age. So what do we do? So we learn to exercise and learn which high intensity exercises, that is with the TheraBand or resistance training, some kind of exercises wherein by the muscles are sticking to the bones very well. I always give you this example that if you meet your grandchild after 2-3 years, suppose you have your children are living abroad and they are coming to meet you after 2 to 3 years. So how are you going to hug your grandchild, grandson, granddaughter if they are meeting you after 2 years? You will hug them very tight. See, Sudha Rastogi, this is the answer I wanted from you. So you're going to really hug them tight for a very long time because you miss them. So what I want to convey here is through this little synonym, I'm trying to compare that you are the grandmother or the grandfather is the bone, whereas your grandchild is the muscle. Followed that hugging example, why I gave? If you exercise properly, not just yoga, if you do any kind of exercise where strength training is involved, then the muscles are gripping the bones well. And although you fall down, you will not mostly get a fracture because the muscles will be supporting your bone. But if you're too lazy, you don't want to exercise, there is a gap between the muscles and the bones. And because you have fallen, that bone gets the risk of fracture and breakage because it is separated from the bones, from the muscles. Is it making sense, the newcomers? Pramila Dingreja, Suman. So important it is for you to keep doing some form of exercise every single day. So today also my friend called up. She said, Divya, I have joined the gym. It's been a month. She's 60 now. And she thought she has already told me, but I had told her now I will not stop. I will stop talking to you because you're only complaining and cribbing and telling me I'm getting this. Where is your form of exercise in the day? So she says, see, I don't like yoga. This doesn't suit me. I get vertigo. I said, any form of exercise. So because I told her you're not going to call me up till you do something, now she has joined the gym. But what she is doing, she is going one day and then she is getting tired and not going the next day. Now she's saying because it is in the gym, it is in the club, like Hindu gym, so they don't charge you much. Okay, the trainers are also free because you have paid membership. Huh? Hello, Sejal madam. Long time you come after a long time, very long time. So what do they do? Then she says, I don't get lockers, so every day I have to carry my shoe and go. और मुझे कंटाला आता है shoe को उठा के लेके जाना. Happens. Lakshmi madam is also smiling. Then she says, today somebody's funeral was there. Tomorrow, day before yesterday also, I didn't feel like going. Yes, welcome. So will this work? 1 month you join the gym, but you're going very, very sporadically. So do something which is doable, which is there, which is accessible, which you can do every single day, which suits your pocket. Okay, so that you can be doing it every single day. Yes or no? Am I saying the right thing? If somebody tells you only thrice a week exercises are enough, no, they are not enough. You have to do them like the way you eat food. You eat food every day, twice, thrice. Like that, you have to be doing every single day. Otherwise, what you have been done has been erased. So it is okay if you change your form of exercise. One day you can walk, one day you can gym.
देखो कितना मिनट रह गया
सुधा मैडम म्यूट करेंगे क्या? But it is regular. Hello, Dilip sir. Every single day without fail, you have to exercise. Why? Tell me the 4 lines, Nikki. Tell the newcomers the 4 lines. Nikki, are you there? Who will say the 4 lines? Mini Gogia is not around. Neeru ma'am is not around. Who remembers the 4 lines? About movement and why you should be moving. Geeta, Radha madam, why you should be moving every day?
So that you will get the strengthening of the muscles.
So what are the four proverbs which I always tell you?
Motion is potion.
Movement is motion is lotion.
Motion is lotion. When the body moves, the mind grooves.
Very good, Carol. When the body moves, the mind grooves. Motion is lotion. Movement is medicine. Movement is medicine. So what is the first sign of a person being alive? Movement, locomotion. Stagnancy is death. Locomotion, no? How amoeba also takes its pseudopodia and moves. A single cell structure can also move. That is the indication that the person is alive. So you have to keep moving. In case you're too lazy to exercise, whenever the doorbell rings, get up. Whenever something happens, get up. That is known as NEAT. That is also a form of exercise. That is known as non-exercise activity thermogenesis. There is heat being generated through some little thing of you getting up, doing your household chores. Okay? Try to get up every time. That is also an exercise for you. NEAT, NEAT. Non-exercise activity thermogenesis. Examples can be park your car away, walk a little more mile. Okay? Don't get your vegetables and everything ordered online. Go down and get them. See them, feel them with your hands. That is also an exercise for you. Okay? Remember, the big companies do not want you to move. They are giving you everything at the click of a button. Everything. Cheaper rates. They do not want you to move out of your house so that their businesses increase. What says Sankara Sundari madam? So this is the main example of that. Strengthening the muscles around the ankles, knees and hip region help the muscles to have a firm grip around the bones, thereby preventing risk of injuries and fractures. Did you understand this very, very deep first objective, which I spent almost 10 minutes on? Now, this I will be explaining tomorrow. Hamstrings and quadriceps are antagonistic muscles tomorrow. Hips store emotions and tight hips lead to pelvic diseases, abdominal affections and hip disorders. This means that there is a proverb that the hips store unrefined emotions. Okay, and many of us have such tight hips that we cannot separate our legs and bend forward. It is very, very, very extremely excruciatingly painful for us to do that. Okay, and tight hips can also mean constipation. Tight hips can also mean a tight prostate, means and very inflamed prostate, or pelvic inflammatory diseases. It's known as PID, male female both. PID, pelvic inflammatory diseases, because of tight hips. Okay, and remember, hip fractures more than shoulder fractures are very difficult to heal at your age, because once the fracture occurs, there is superficial infection, there is some abscess or something, and usually the senior citizen does not recover from that. So it's a good idea to avoiding fractures itself. Then, so followed, it can lead to abdominal infections also. Then, if you have been struggling with frequent sprains, so this line is for your ankles. Haven't you seen that there are many people who sprain their ankles very fast? It's known as a misstep. So they are walking on the footpath also, and they'll get, immediately they'll, even youngsters, they'll just have a false step or a misstep kind of thing. So this happens because the muscles around the ankles are very weak. So once you learn, remember that first grandfather, grandmother story. So once you learn to grip the muscles around the bones, then what's going to happen? Obviously, you will not sprain your ankle if the muscles are strong. Okay? Especially for seniors, 22, for youngsters, nothing happens. Even if they sprain the ankle, it does not lead to a fracture usually, because the bones are very strong at that age. But since we are all going through osteoporosis, now that day also somebody, I went for my 10 days this thing with another lady, 74-year-old. She's fully bent. And I told her, she's telling me, see, this I've taken and my osteoporosis has gone. I said, look, osteoporosis never goes. The very fact that you're drooping like this means it's osteoporosis. Okay, a hunch means a osteoporosis. Your dress is getting shorter and shorter, longer and longer. You needing to hem your dresses means it's a sign of osteoporosis. What you can do is you can halt the osteoporosis by only exercise. And that means regular exercise. Now my private student has come. She has gone in July. She had gone to her son in Seattle, and she just said, I need to start the class again because I didn't do any exercise over there. So you'll have to teach me everything from basics in my private yoga class. Why did she say that? She used to have time. Her son and daughter-in-law were working. She used to have time. But what people think, if I'm on a holiday, I don't have to do anything good. She has not taken her vitamin supplements. She has not just done anything. She has only worked whole day to keep good food on the table. And then now she has literally collapsed. Is it a good idea? So where is it written that if you give like this the treatment to your children, then that's being a good mother? No. A good mother will first take care of her health. Followed? Then only she can take care of the others. Okay. So fear of inviting diseases like PID, as I told you, confuse which exercise to choose from, unable to perform daily activities due to rigid and tight hips and pelvis, then this is the right class. We will be learning to manage pain in the right manner. So first of all, let us understand what is the anatomy of the hip joint. Okay, so this is the hip joint, and these are known as the iliac crest. Now this top, we all can feel on the corners a little above the panty elastic. Okay, we can feel this bone. We can also feel these two bones. What are these two bones called? What do we do them in yoga practice? Tell me, how do we sit down? This is the femur bone.
Vajrasan.
Vajrasana.
Sit bone.
Vajrasan.
Bone, sits.
Sit bone. Sits bones.
Beautiful. The ones who said, I think Sudhara Stogi and Carol said 6 bones. So newcomers, you can Google. The spelling is SITZ. SITZ.
They call it as sitz baths, no ma'am, for hemorrhoids.
Yes, sits bath. Okay, Ruby madam, very good that you observe. The doctor also prescribes like this, SITZ, sits bath, you sit in the tub. But what does he mean when you sit in the tub? You have to pull your buttock flesh on the sides and you sit on these two bones. Okay, you sit on these two. Have you seen that they're a little flat? Can you appreciate they're a little flat and then rounded and then they go up? Okay, so because they are a little flat, what happens is when you sit on these bones, even irrespective of you doing yoga or anything. So now Madhu Gupta is sitting in her car, but if she pulls her buttock flesh on the right side, left side, the driver will not come to know that she is doing it. She will be slitting on the seat bones. Or then another name is buttock balls. So many names for the sits bones. Okay, so you should not be sitting on the round of your buttock. And why should you not be sitting on the round of the buttock is because when you pull your buttock flesh out and you sit on the flat of your buttock, that sits bones, your spine by default gets straight, gets erect. So one pay one free. We like no one pay one free, one pay two free. Okay, so why were we not doing it before, Sejal madam? Because we didn't know. So we are going to do it from now. Okay, so by default, if you pull your buttock flesh right side, left side, I don't mind if you don't have too much buttock flesh, but everybody, whether you are obese or thin, needs to be doing that and see how your spine gets erect. Clear? Very simple to understand. Huh? Always when you sit down, sit like this. Nobody let people laugh. It's okay. Fine. Did you follow this point? Naresh Malik, did you follow? KGY Raman, did you follow?
Yes, ma'am. Yes, I did.
It's okay if you admit me. I have a lot of patience. In fact, you seniors have taught me this patience. I will teach you through different ways. I have many ways, many styles, but you should understand because you have given me this 1 hour. It may be a free class for you, but if you have given this 1 hour of precious time, you should have returned gifts after the class. You should be incorporating some learnings into your daily practices. And I don't think asking too much from that. Right? Let's proceed.
Doctor, I just remembered when my mother used to sit, she used to rub her hand on the bottom to make her dress straight, sort of, it doesn't get crumpled. But I think this is what she used to do. Sit on a bubble.
Yes.
That style, it looks so nice, like as though she wants her dress not to get crumpled at the back.
Yes. But what I mean is, I need you to pull it on the side, huh? Not in the front.
No, she used to bring her dress on two sides.
Okay. Thank you, Sejal madam. Thank you. Yeah. Okay, come. Let's follow it, Maria. Follow it.
Yes.
Okay. Now, this is the hip joint. That's the femoral head. Upper extremity, extremity, we have upper part of the arm, and this thing we have just one bone. Lower, below the knee also we have two bones. I'll just plug in 1 minute. Okay, let's proceed.
Just what are these blue rings like that I see in the drawing? I'm sorry, I came late.
Doesn't matter. Next time I would like you being on time, huh, sir. I'm a good teacher.
Yeah, that is true. I misread the timing.
These are the intervertebral. These are the
I read
cushions, sir.
I read it at 5 o'clock
and these are the intervertebral discs. Follow?
Sorry, I didn't quite.
Cartilage.
Cartilage, kind of the support system. It attaches, no? There is soft substance, cartilage kind of substance, no, where the bones attach. So these are the intervertebral disc. This is something which herniates when we have a slip disc. This is your sacrum. It's again, sacrum is 5. Okay, they've shown you 4 here, And then this is the tailbone, right? Females have larger pelvises to facilitate childbirth. Males don't have very huge pelvises. So this is again the ligament and the joint capsule. See, this is articular, means the sticking capsule. It's exactly like the coconut kernel. This is your head of the femur, okay? And the bones in between have something which is known as a synovial fluid. Now, synovial fluid starts decreasing after the age of 40. So it's a good idea to be moving the muscles, moving the joints each time. Hello, Bala Arora. So that the synovial fluid is secreted. Another good idea is before you exercise, take a warm water bag on your knees and then exercise your knees. Why? In support to that warm water, little bit of synovial fluid or lubricating fluid is secreted by the body. And then the exercises get comparatively easier. Right? So that's your tibia, that's the lower after the knee. Now this is what? The knee is supported by many ligaments. There are lateral ligaments, there are anterior in the front, posterior ligaments, many are there. Okay, so this is just a because the class is on the hip joint, the knee joint and the ankle joint, I'm just taking this slide. I will teach you more in detail. So what causes hip pain? Why do we complain of hip pain? So first of all, there is osteoarthritis. Okay. Now, do you think I can escape osteoarthritis because I have a lot of knowledge? Do you think I can escape from osteoarthritis? Do you think because I have a lot of knowledge, can I escape graying of hair? Do you think I can escape cartilage, the lens of the eye getting cataract? No. So these are all, osteoarthritis is also an aging process which happens to everybody. How much ever you try, it will happen to you because it is a wear and a tear procedure which is happening. But, so listen to this line very carefully. Osteoarthritis occurs to all, but not everybody suffers from the pain of osteoarthritis. There are many people who can sit on the floor for an hour undisturbed and meditate at 74, 75. And there are many youngsters at 30 who can't even sit on the floor. So it is the way you have exercised from that time, but it's never too late. Never too late. Suppose you can't do, first of all, you should differentiate. If it is bony pain, very excruciating kind of pain, then you should not force your body. But if it is a muscle ache, that means you're challenging the muscle. Sit. If it's paining, sit for some more time and then open up. The logic is that the body creates opiates. What are opiates? They are pain relieving things, chemicals. So the body creates opiates, and after that, after some time, that same pain does not hurt. So we say no, that you've got immune to the pain. The logic is nobody gets immune to any pain or anything. The body starts secreting some anti-inflammatory chemicals and which soothe and wash away the inflammatory chemicals which are present in the painful joint. So it can be osteoarthritis, then it can be inflammatory arthritis, maybe because of some injury. Now, there is this muscle, which is a deeper muscle, which is known as the psoas. Many of us have studied about it earlier. It's a deeper muscle which originates from the T12, that is the thoracic 12 vertebrae, and it goes and attaches to your femur bone, the head of the femur. So that muscle, if it is tight, or if there is bursitis is a cavity that is inflamed, then also a person can be having a lot of hip bone. Snapping hip syndrome means it keeps coming out and going in, coming out and going in. Okay, or there can be a fracture. There can be a hip flexor strain. So psoas muscle is a hip flexor. What do you mean by a hip flexor? Is when I am getting up, I use a flexor. When I am sitting on my chair, I use a flexor. Okay, when I am doing Pavan Muktasan, or when a simple baby is crying and lifting his feet up to his tummy and chest, then also a hip flexor is used. Because hip flexors are used so much, there is a strain on the hip flexors and then they stop functioning. And then you start getting pain. Then there can be a hamstring muscle, which we will learn in the knee pain. And then there is hip labrum tear. These can be the causes, few causes of hip pain. So what is the meaning of a hyperactive psoas? Sometimes the muscle used is overactive. Also, haven't you seen that our bodies, they do not function equally on both the sides? We have bilateral bodies, but we can always say right hand is more powerful, left hand is a little weak. When we stand and we do Ekpadasana series, we can say, oh, my left foot can take the weight of the whole body, my right foot cannot take. Why does this happen? This happens because of some wrong alignment in the body, and then the one which is used gets overused. Okay, whereas the other one becomes too lazy and it becomes short, and the overused one, the muscle gets stretched and becomes long and loses its elasticity also. So it's a good idea to be exercising with proper alignment. Very important to understand. Suppose you're doing some simple, like today in my private class, I was telling them, I have so much of explaining. He said, ma'am, we've never understood this. You're just moving and you move your hip. No, the hip has to be glued to the floor. So many little things in a lateral bending you have to understand. Then your yoga asana becomes refined. Then you start getting the benefits out of yoga also. Otherwise, it is just a simple clown show. So the other reasons can be weak glutes, yes, and poor posture. So this is my favorite thing. What do you mean by a weak glutes? Nisha Ratish, bolenge kya? What is the meaning of weak glutes?
Gluteus muscle.
How they can get weak?
There's no activities, there's no exercise, then it becomes weak
How do you not get activity? Like I tell you, I went for a retreat in 10
all
days.
the time.
My glutes
Sitting
started
all the
because whole day we were sitting and meditating. I went for Vipassana. So then I realized, oh God, it's a sin to be sitting, which never happened, and my knees started paining over there. But here, whole day I'm there, and there's no knee pain, and I no glute pain. Why do you think the glutes get inactive? Is because of prolonged sitting. You should not be sitting whole day. But suppose you are a consultant. Yes, we have senior citizen consultants also who have to sit down. Then what you are going to do? Many of you all do consultancy, no? Even after you have retired, you have to sit down for long hours with the computer. What will you do? Tasneem Pital, tell me what
After half an hour, change the
that's
positions.
what you can't do. You're taking back-to-back meetings. You can't.
For that, you told keep pressing the hips and do some exercise.
No, ऐसा some नहीं बोलने का. Tell me properly, then I'll say proper.
Squeezing the
Kegel,
hips.
Kegel exercises.
Kegel exercises. I was coming to this only. Kegel exercises.
Well, but gluteal contractions. So we are all sitting here. Come on, Naresh sir, sit straight. And we are all going to contract our glutes and see if you come to know I have contracted my glutes, and I come to know. Nobody comes to know that you have contracted your glutes. So is it a difficult exercise? Nobody comes to know. You just have to do it even if you're seated for very long hours to strengthen your glutes. Come on, tighten them, and your Kegel and anus banda will happen by default. One pay, one free. Come on, tighten. Come on, squeeze. 1. Both the hips together. 2. Carol, are you doing it? 3. 4.
Yes.
I come to you, Naresh sir. 5. You don't know how it's done, then I explained it to you before. Yes, tell me. You're on mute. You're on mute. You have to unmute yourself if you want to ask me something. Naresh Malik. You're still on mute. I'm not able to hear you. You'll have to unmute, sir.
Yeah, yes. Now I have done it. You see, I do in the morning 3 exercises. One, we rotate our knees, you see, slightly bend, and then rotate the knees clockwise and
Never do that
anti-clockwise.
exercise, sir. Never do that exercise. I'll explain it.
Why?
later to you.
Acha, knees should not be done.
No,
And
no, knee is not a ball and socket joint. Only ball and socket joints are rotation. Never
What
bend it
about
and rotate
what about
them.
the waist? You see, waist also we rotate this
Waist
way
rotate.
and that way.
Chalega. Never bend knees, never rotate.
Okay, okay. Knees I will not bend.
Knee.
And then we have Tadasana. I mean, we strengthen, lengthen as well. Is it okay?
No, sir. I am teaching you
Raise our hands on the top and then.
Yes, sir.
do
Yes,
it.
sir. I understand. But these exercises, no teacher will teach you what I'm teaching you. So be careful and do them.
Okay.
Okay.
Thank
You
you,
heard
thank
of this exercise? Does your teacher teach you?
Okay, thank you.
Yes.
Knees well, I will not do it. Right?
See, there was a good point in you sharing it. Okay.
Okay. Okay, thank you.
So now what we are doing is a buttock contraction.
Ah,
Both the buttocks. Wait
Yeah.
that count of 10. Come on. I'm giving you count. 1. Sit down and do
Okay.
it, sir. 2,
okay, okay.
4,
Thank you.
5. Mute yourself, sir. 6, 7, 8, 9, 10, and release. Now, how did we release? Yes? How did we release? Can you understand? Yeah, now we are not going to release like that. Okay. Now
Do
we are
we
going
have to hold the breath, ma'am, while
No,
contracting?
everything is in normal breathing. So now the way we are going to release it, we are going to go to the count of 10. What is that? Let's just mute your Sudha madam, mute. We will go contracting to the count of 10. We will wait for 10 counts and we will start releasing bit by bit, part by part, piece by piece, the buttock flesh slowly to the count of 10. 30 counts. Not followed, please tell me, I'll repeat again.
Yeah. Please explain, ma'am.
So we
The
release.
count of 10 contract. Wait there for 10 counts and start releasing the buttock flesh to the count of 10. Come, let's do it. Back straight. Pull out the buttock flesh. Sit on your sits bones. Okay. Chin tucked inside. No vulture necks. Come, let's go. To the count of 10. Huh? So the both buttocks will not go together. There'll be some disparity. Come. 1, 2. Tighten. 3, 4, 5, 6, 7, 8, 9, 10. Is that the hardest contraction? Stay there. Continue that. 1. Stay there. 2, 3, 4, 5. Stay there. 6, 7, 8, 9. Then start releasing bit by bit, part by part, flesh by flesh, piece by piece. 1, 2, slowly. 3, 4, 5, 6, 7, 8, 9, 10 minutes. Is it tough? Did you come to know I did it? No, nobody comes to know. They're your glutes. So please do this exercise. Okay? You can't be saying, I don't have time. On Amazon, you don't get time. In the store, you don't get time. How kilo time? No. Time is a commodity which has to be created, and we create it for the things we like. Here, followed Naresh Malik sir. क्या आप वॉक करते गए नहीं समझ में आया?
Ma'am, does it cover all the Kegel exercises, this exercise?
नहीं समझ आ गया, ठीक है. वो नीज बेंड करके नहीं करेंगे, बाकी थाई को रोटेट करते हैं वो चलेगा, और कमर का रोटेशन ठीक है चलेगा, वही कर सकेंगे, बाकी बंद कर देंगे. ठीक है, थैंक यू वेरी मच फॉर दैट.
But
How does this help?
Tadasana also is.
So Kegel हो जाता है. This is creating some movement in the, let me use the word, dead buttocks.
Okay.
I cannot more. I cannot use another adjective because there is in the whole day no exercise for my buttocks and they are just seated on the chair, right? They are not being used. And
Ma'am, one exercise that you had told us about this
knees only, and you were keeping the block between the thighs and then you pressing it. The first exercise that.
We finished doing that today morning.
Okay, I missed it. I had gone to the hospital. So that also is a Kegel. Yeah, okay, right.
That is a very whole this thing. You must come for the morning class also, because that's why I have created this class. I will not be teaching you anything practical. If you come morning 9 to 10, then you will get practical knee exercises. Now, in case you all have missed it, on Friday 9 to 10, there is part 2 of the knee exercises.
Okay, right.
Morning, is it?
Yes, morning.
Morning.
9 a.m. Okay, followed or not followed. So, what can be the benefits of this? Some simple just gluteal contraction. You will not get sciatica. Hello, Sana madam. Sana, I've seen you before. You will not get back pain. You will get reduction in knee pain also. Why? How come? Because everything is connected to each other. Yeah.
Yeah.
Right?
Yeah.
Good.
We feel the hamstring. While doing this, you feel the stretch in the hamstrings also.
That's all. They're all cousins and all related to each other. The whole body somehow is related to each other. They may be distant relatives, but it's all together. Then the mind can manage the IBS. Why not?
Right.
But I can't sit down.
So who's asked you to sit down? We are just speaking of the gluteal contractions, which can be done. Do you know they can be done best while lying down? They are done best while lying down. The whole chunk of the buttock, you can feel it. They are even done best standing. But lying down is best because the bed or the floor offers you resistance. Who the hell has asked you to sit down? I haven't asked you to sit down. It's okay. Followed? This exercise doesn't, it's not mandatory to sit down. Dilip sir is smiling away to glory. Okay, let's proceed. I think we need part 3 also for this class. So this is what a bursa are small sacs of synovial fluids in the body. Bursae cushion the bones, tendons and the muscles near joint. Bursitis is inflammation of one or more of the bursa. See, so all these bursa, they've shown you in red color. Okay, common locations of bursitis is shoulder, elbow or hip joint. Okay, healthy trochanter, this is the tendon. Muscle does not go and join directly to the bone. Muscle is converted into tendon. Tendons are whitish in color because they are made of fibrous tissue. Muscles are red in color because they are made of more of blood supply. And the inflamed trochanter. Trochanter is the head of the femur, and then there is the greater trochanter of the femur. So this is an inflamed trochanter, can also be leading to hip pain. What can be the symptoms? Their joints might feel achy or itchy. The joint might hurt more when you move it or press it, and joint might look swollen or red. This slide I like because this is the positioning of your body in your genes. See, exactly, through the genes, it shows you how things are. And when you sit, what happens? What is where is the tailbone going in? You can study it like this. Okay, your femur is here. Okay, now sits bones. If you sit properly, your pelvis would have a slightly anterior pelvic tilt. Pain is due to overloading of the hamstrings where they attach. In today's morning also, I told you all that where are the hamstrings? We revised in the morning class that, what did you say, Murshana madam? The smile of the buttock, the back smile of the buttock. From there they commence. That's the back thigh muscles are known as the hamstrings. The front thigh muscles are known as the quadriceps. In fact, we learned how to walk today morning. Please come on to Friday 9 to 10, because in this class I cannot do justice to exercises also. I do not think whether I will be able to cover knee pain or ankle. So we did it in the heel pain, this thing. Let's see how we go about. Then I'll keep separate class for knee pain. Often confused, yes. Sit bones, what is it? Sit bones or the sits bones. Did you see the spelling? and they inflame the bursa, often confused with sciatica. Treatment is ice packs. Now, cold constricts. There's always a confusion between the ice pack and a hot water bag. So what they say is, if it's an recent one, then you quickly do the cold compress. Why? Because cold constricts the blood vessels, whereas heat will dilate it. At least because of constriction, it will stop the bleeding. Then it's often confused. Yes, avoid sitting on hard surfaces if you have these issues. Then balancing on your sits bones helps you to elongate the spine. Yes, this is it. Distribute your weight equally on both the sides of the body. Beautiful, excellent, wonderful line. Balancing on your sits bones helps you to elongate the spine, which I mentioned at the beginning of the class, and distributes your weight equally on both the sides of the body. Now, if you have distributed the weight on both the butt, now today also, I'm speaking to you, I'm sitting more on my left buttock. All of y'all think we don't sit well on the seat, and then we start getting complaints, and then we visit doctors. But if we learn how to balance and take the weight on both, it is something akin to simple. One person working in the family of 4 will get tired if the others are not helping. Okay, followed? Is it difficult to understand? But be constantly with that awareness that I have to balance my body weight. When you are walking, imagine the COG. What is the COG? Is the center of gravity. Imagine a long pointing rod going through the center. Am I just moving? Is it like this? The center of gravity should be proper. Then you will not get malalignment issues. While walking also, am I bending too forward? Am I bending on one side? So when we pull, we are exposing the bursa sac and the hamstrings and the adductor ligaments to unnecessary pressure. Overdoing forward bends in yoga causes pain. Okay, so this is the head. This is the greater trochanter. This is the greater trochanter, which I spoke about. The bursitis can lead to hip pain. Okay, so hip pain is common complaint, can be caused by a wide variety of problems. The precise location of your hip pain can provide valuable clues about the underlying cause. Problems within the hip joint also can be there, and around neighboring muscles, ligaments, tendons, other soft tissues can also be having issues, and hip pain can sometimes be caused by disease and conditions and in other areas of the body, such as lower back or your knees. So this is what I told you. Sometimes knees can also have issues, and it can be referred. This is known as referred pain. Okay, what do you mean by referred pain? That the problem is somewhere else, but the pain is manifested somewhere else. Happens, no? Your husband shouts at you, and then you shout at the maid, because children you can't shout, no? Maid also you can't shout. Nikal jayega. Right? So this is known as referred pain. Understand what is referred pain? That example, remember. And it is needed when you want to treat it and it's not responding to any kind of treatment. That means it is not per se knee pain, it is because of something else. So can we cause this type of pain is called as referred pain. Most hip pain can be controlled with self-care as home. So it can be other areas like lower back or the knees, and it's known as referred pain. What causes thigh pain? Okay, so now this is very common. I keep getting this. Okay, suddenly I don't even look at myself when I'm having a bath, because for my class I have to be there at 9 o'clock on other days also. So I have very quick bath, and then suddenly I look down and I see some blue ecchymos. So again I'm banging here, and my husband always says, you're very clumsy. You're very clumsy. You bang into things. You're always in a hurry. You're a clumsy. Oh, so then if there is an injury, that can also lead to thigh pain. Okay, so there can be a blood clot, or there can be a tendon. Tendon, if it gets inflamed, the quadriceps, the front thigh tendon, then it is known as tendinitis. It can cause pain. Or iliotibial band. So this band, iliac crest, I told you, is the hip bone, and tibia is the lower, below the knee, the bone. So there is this band which attaches from the ilium to the tibia, and it is known as IT band. अभी नहीं manage कर
Excuse me,
yes
we don't get link for the morning class.
yes morning class.
We don't get link.
You will not get direct links now. You will need to download the Get Setup application. Okay, go to Play Store and download Get Setup application, and then you come to the class directly from there. Come to the class directly from there. That is. Is that okay? You can join the class directly from there. Now we do not send direct links. We want
Because this is through Dignity.
so but mobile phone everybody has, no?
Yes.
So download Get Setup India. If you don't understand, ask Abhijit. There are many people to help you out. How to download it? Very simple. It will ask you for password or whatever, and then come directly through the class.
अच्छा मैम, थोड़ा सा मैम का यास्पद क्वेश्चन हिंदी में बोलती हूँ. Can you say something about the knee problem? I'm one of the sufferer because I don't want to go for surgery. Something.
Because abhi it is just 5 minutes. If I start with the knee joint, we will not be able to complete.
थोड़ा सा 2-3 जरूरी बातें बता दो.
आपको मजा ही नहीं आएगा जरूरी में. आप 1 घंटा मुझे कल मैं मांग रही हूँ आपसे 1 घंटा 3 to 4 कल अच्छे से समझना ना. छोटा सा रसगुल्ला क्यों खा रहे हो? पूरा रसगुल्ला खाओ ना.
नहीं, डायबिटीज हो जाएगी.
नी के पहले के क्लासेस होंगे ना, ऐप पे होंगे ना रिकॉर्डेड?
रिकॉर्डिंग देंगे कि
नहीं है,
पता नहीं मैडम. अभी लास्ट टाइम डायबिटीज था, डिप्रेशन था, फिर मैं ही नहीं थी 10 दिन, तो मैंने भी चेक नहीं किया है.
अच्छा, कोई बात.
तो जो मेडिकल कैंप रिसेंट होती है ना, वो लोग डालते हैं.
अच्छा,
आप 2-3 बार देखो, चेक करो, फिर से सुनो, तो आपको क्लियर होगा.
ओके,
ठीक है. यहाँ पर एक्सरसाइजेस नहीं सिखा पाती बिकॉज आई कैन नॉट मैनेज एवरीथिंग टुगेदर. दैट्स व्हाई नाउ नेक्स्ट टाइम वैरिकोस वेन्स का है पार्ट 1 पार्ट 2. तो सुबह के योगा क्लास में आई पुट विपरीत करनी एक्सरसाइजेस फॉर वैरिकोस वेन्स.
Varicose.
After I have put neuroscience of pain, so I have put Sahaj Bhavasanas in yoga. I said I try to correlate. Yes, Sana madam.
Yeah, I just wanted to ask you, since you're saying varicose veins, next in the sense, when would you be having that?
I come on Tuesday and Wednesday 3 to 4 for a medical camp, and Tuesday and Friday 9 to 10 a.m. for yoga. Okay.
Tuesday and Friday. Okay, so this Friday you're having the
knee pain.
Varicose veins 9 to 10 in the morning.
Knee pain, madam. Knee pain.
Madam, which link, madam?
Okay.
Madam, which link, madam?
Yes.
Madam, the Play Store we have to go Get Setup India, madam.
Get Setup India.
That's all. No dot and all, madam.
No.
Only this.
To Abhijit, you all must be having some support, no?
Yeah, madam.
Don't worry. Then you can attend all classes, not just mine. Chalo, let me just quickly go through little fast.
Yes. Okay,
then injury, spinal stenosis. What do you mean by stenosis? The gap becomes small and the nerve is pressed. See, yellow color is always a nerve, pinched nerve. This can also lead to back pain, hip pain, if the nerve is being pinched something very higher. Then healthy hip joint, and then this is osteoarthritis. What is this? जैसे नारियल की मलाई होती है ना, कैसे टूट जाती है, सिकुड़ जाती है, exactly like this. See, and that's why when we move, when we walk, we start getting pain, and it is known as osteoarthritis. See, this blue thing has become very jagged edged. The edges have become very jagged.
Sometimes you get sound, madam, cut sound. What is that?
One minute. So what is happening if I mute all of y'all? I do not like it because we believe in freedom of democracy. But if we interrupt all the time, then we will miss out the knee camp tomorrow. So I do respect your questions, but keep them on hold. And If it's very, very important and if not followed, I do not like to mute y'all. From beginning, do I mute y'all ever? From 3 o'clock, y'all are there. But we should be guarding our questions. Are they for the benefit of everybody? Or are they just curious questions that why is this happening and I don't gain anything from it? Am I speaking sense? Okay. So we've
Yes.
all 3 p.m. Yes, like this, we will just be gallivanting. Again, arthritic hip joint with worn cartilage. So, symptoms of hip osteoarthritis. So, I'll just finish this slide. There is difficulty putting on shoes and socks. Okay. Pain deep in the front of the hip or the buttock. Pain can refer down the leg, difficulty in daily activities, pain walking, worse if faster, further, or hard on uneven surfaces, may develop a limp because one side of the leg becomes shorter and one side gets the normal length. Bent up positions, painful sitting or squatting, hip pain at night or morning aggravation, and pain rising from the chair. So what I'll do is, we'll end the class today, and tomorrow we will take initial part of hip pain and a lot of knee pain. Okay. First of all, understand.
So tomorrow, what time, ma'am?
3 to 4.
3 to 4, same. Okay.
And in the application, there is a magnifying glass. Go there and find whichever trainer you want. I am Dr. Divya Sitlani. So you can go there and look for all my classes. Okay. So find out which trainer comes, which guide comes at what time, what are their days. Then whichever you attend. You will gain from every guide. Okay. So we meet tomorrow.
Thank you.
And sorry, I'm not able to take questions in detail if they are not significantly related to the topic, and I hope you don't mind it. I have to be stern and I'm not going to apologize because I mean it. Okay, you may be senior to me, but when I mean it, I mean business. Okay, we are giving each other our time. Thank you for the gift of your time, energy, and
Thank you.
attention. Tomorrow,
Thank you.
we
Thank you.
have a date with each other.
Thank you very much.
Thank
Thank you, Anurag.
Thank you, ma'am.
Thank
Thank you all. Bye, ma'am. Bye, all.
Thank you.
Bye.